Can you give me information on HIV and AIDS?
HIV is the human immunodeficiency virus. It's the name of a virus which can, in some cases, go on to cause a condition, a syndrome called AIDS. So HIV is the name of the virus, and AIDS is the syndrome that it can cause, the illness that it can lead to. HIV is an infectious illness. The virus can be passed on from one person to another. But equally, it can be stopped. You don't have to pass it on. Safer sex and safe injecting is a way of stopping a virus from being passed on. The most effective way to stop HIV being passed on during sex is to use condoms, which are very simple to use, are available pretty much everywhere. You just have to remember to use them. The rubber, the latex of a condom is a really efficient barrier between one person's body and another. The HIV virus lives in blood, but also in the vaginal fluids and in the semen of a man. Also, incidentally, it exists in the breast milk of a pregnant woman. So in order to prevent HIV being passed on, you have to avoid the blood of a person who has HIV, and then also the genital fluids of a man or a woman who has HIV. Safe injecting means not using needles and injecting equipment that's been used by someone else. So stick with your own fits, your own needles, your own syringe. When using condoms, it's really important to use water-based lube as well. The lubricant makes it easier for sex to happen, makes it smoother. It also makes sure that the condom is less likely to tear or to fall off. It can also be a better feeling too. Water-based lubricant, especially because oil-based lubricants can dissolve the latex, the rubber of a condom, and they can cause it to split. So condoms and water-based lubricant for safer sex. Treatments today are very effective in suppressing the action of the virus and making it easier for a person with HIV to live a long and happy, successful life. HIV treatments are usually taken in combination. Some people might have heard of combination therapy, which is another word for the same thing. It's usual to take 3 different types of drugs at the same time, but they will be needing to take pills every day for the rest of their life, which will suppress the action of the virus and keep them relatively healthy. The modern drugs that are available now tend to cause less side effects, but they still can have some effect. Those side effects might be nausea, feeling sick, but then also some more severe side effects which can affect different organs in your body. It can cause complications with other illicit recreational drugs. So it is extremely important for somebody who is taking HIV medications to consider carefully their other drug use. So if you should have an exposure to HIV either through sex or through using somebody else's fit, there is this treatment called PEP, that's post-exposure prophylaxis, which is a month-long course of pills that can be taken very shortly after an exposure to HIV, which can stop the HIV virus from getting a hold.
With HIV, we cannot clear the virus, but life expectancy can be extended very dramatically by the antiviral drugs which are now available for that disease as well.